Okay, Mike Masato here, returning for episode 25 of the Dental Road Warrior. I'm the CEO of Staff Driven Dental, and today I want to discuss emergency patients, a topic that comes up quite a bit in my consulting with doctors, and we don't really ever handle it properly. When I go into a practice, I don't see it being done in a good way, and I've heard a lot of varying reports on how we handle emergencies. All right, first of all, these aren't necessarily the best patients in the entire world, so you have to understand that and know that it's got to work first and foremost for your schedule and not at the inconvenience of your existing patients of record who are on the schedule, and also your staff, but also these patients that are on the schedule that keep their appointments, take care of their oral health, are responsible, they pay, their families are coming, they show up. You know, these are things that we don't. These are patients that are our bread and butter in our practice. All right, so you have to understand emergency patients are not the best patients you possibly can get. Now, if you're a clinic, that's fine. If you're listening to this in your clinic, more power to you. See 100 patients a day. That's what you do. If you are an oral surgeon, you're an endodontist, you have emergency patients left and right, they pop up. You have to be ready to accommodate it. That's what it's all about. But if you're a general practice, all right, that you have to understand that emergency patients have to be handled in different ways, and that's why it's good to have training at the front desk, to have them understand when there's some kind of new patient intake process when they call up, to understand how to handle these inquiries when people say, hey, I got to come in, I have an emergency. Well, the first thing is to qualify, is it truly an emergency? All right? And the way a couple easy ways to check that, ask him, well, how long has it been bothering you? 6 months, not an emergency. All right? Well, come on in now. We need you to come in now. It's important. We have an opening. I can't come now. I'm at work. Not an emergency. All right? See, there's easy ways and qualifying questions you can ask patients to find out with right away. You know, if they are truly an emergency patient with an emergency situation you're going to handle. But overall, the idea is that I've heard this before, and other consultants teaching this years ago. I heard someone consultant teaching, well, you got to clear the deck for emergencies. Meaning, like, if you get an emergency, they're gold. So, you know, we're going to get them in the schedule no matter what it takes. And even if it's at the inconvenience of other patients, which is a big no-no. All right, there's no way you do that. You look at the schedule in the morning. The morning huddle's the time to decide when we're going to see emergencies and where. You pick a couple spots in the schedule. You tell the front desk, I'm going to see an emergency here and here, and that's it. There's no, way we're going to basically vary from that. All right. So now, look, there are 4 types of emergency patients. You have to understand that, and you're going to handle them all a little bit differently. All right. There are 4 categories of emergency patients. They're all handled a little differently. Let me go over them with you now. First of all, there's the new patient, not a true emergency. There's the new patient, true emergency. There's the existing patient, true emergency. And then there's the existing patient, not a true emergency. And if you can tell, when you kind of categorize them like that, they're all handled a little differently. Now, obviously, the best patient, the one we're going to basically go out of our way for a little bit and extend ourselves and work it out, is the existing patient with a true emergency. Right? These people are good patients, and they've actually had something come up that's legit, and they need to get in to see you. We're going to make some accommodation in the schedule, but these are people that also we can come in when we want them to in triage and work around, and they'll wait with you and they'll work with you on your schedule because they are a good patient of record and it's a true emergency. So that shouldn't be so difficult, but that's one. Then there's a new patient, not a true emergency. These are the worst. Lowest retention rate, highest level of problem, not being quality patients coming in, one and done kind of people. Look, the whole goal with new patients is retention. We don't want people to have a practice as a revolving door. People come in for one visit here and there, use you as a Band-Aid and leave. All right, so basically, yeah, I know once in a while we always think about that one patient that you saved. You pulled the thorn out of the paw of this poor, person, that and they're indebted you for life, and now they're always going to come to you for life. We remember those, or the one big score of a big case we got. But those are few and far between. The others we bring in there are usually mostly this huge disruption of the practice that don't amount to much of anything in terms of money or retaining any kind of patients, right? And one of the things I always do with new patients to test that are not really true emergencies, if you qualify on that, and you let them know right away, we'll see how serious they are. Your general policy about insurance and money when it comes to new patients should be, right? We do not process insurance when it comes to new patients. So until we get to know them and what they have and what's going on, they can tell you, I got this, I got that. We don't know them. They're coming out of left field. We can't trust this is the case. So you let them know right away on the phone that if you're a new patient coming in with an emergency that needs to be seen right away, that it's going to be X amount of dollars for this particular visit, and in addition, plus any additional, potentially if any work gets done that day beyond actually palliative care. All right, so you should have a policy that we're not going to we'll process the insurance after the fact if they have it and they can get it reimbursed, but we are getting paid first to cover ourselves, because that ended up not being a good quality patient. We're not left holding the ball later in the bill. All right, so it's very important that you put that policy in place when it comes to that. Now we have the new patient true emergency. That is, if they're legitimate, okay, they're going to come in during one of those slots that we've designated at the morning huddle. They will come in during that time if it's a true emergency, all right? And the last one is, if you have an existing patient with not a true emergency situation, look, we can speak to them and explain to them and reason with them, and calm them down to make them understand they're going to be okay, and we're going to see them here, and because we have a relationship with them, and they'll pretty much fall into line if we properly finesse them at the front desk. Again, this goes back to training, scripting, etc., of working with the front desk and how to handle these situations where these incoming calls come in and it's an emergency patient. All right, so again, 4 categories of emergency patient. There they are. They're all handled a little bit differently. As I said before, this goes to do with training. But you have to understand overall that schedule's sacred. It's so important that schedule breaks down or it's disrupted. It's costing you a lot of money, and potentially if you don't handle it properly. It's also a bad PR to make people wait or to inconvenience them or cancel them or move them around a lot. I see this all the time, the schedule being moved around left and right constantly. People don't like that. They have lives. They want to be able to come in and be seen at a certain time. It's an agreement you made with them to see them at this time. And all of a sudden you're changing the agreement on them 4 or 5 times. They never agreed to wait. They never. And the other thing is, if they come in and say, sorry, we would love to see you right now, but we're running behind an hour because of an emergency or half an hour because of an emergency patient. What does it tell them how important you are as a patient? That invalidates them as a patient. What about me? My appointment is certainly not valuable. It's not valuable at this point. I mean, come on. What are they thinking? We don't need bad public relations getting out there. People talk right now. Right? It's a service industry, I've said many, many times before. And how we choose to serve these patients is critical in terms of the response we're going to get from them and the word that's going to get out in the community about who you are. And you also understand what kind of quality dentistry you're going to do. If you're effective your time and you're cutting into your time for your hygienist or for your assistant or for you, what kind of quality are we going to do there? I mean, you about quality dentistry, if you are, you have to have enough time to spend on people. There are certain things you just can't cut corners on. Time needs to be there. And that's what that whole schedule's about. It's about putting a schedule together that works not only for productivity but also time and for service and attention to the patients. And emergency patients are often a major problem if not handled properly in the practice. All right, as you can see this, and most of the time it's not. So it shouldn't be, oh wow, it's amazing, it's exciting when a new patient calls up there. All right, again, like I said before, if you're a specialist that handles emergencies, you're a clinic, different story. But again, if you're a general practice, this is not the lifeblood of your practice, that you're available all hours of the day at the inconvenience of everybody else to see a new patient emergency here and there. All right, again, that doesn't mean they can't be good, but I'm saying this is what you should not plan on making your financial living on and bank your financial future on is emergency patients, because if you really looked at it, you're going to find out that the majority of these people are not the best patients in the world. They're not the best quality patients in the entire world either. All right, but again, so take care of them, but make sure you qualify them. Make sure you put them to the process that I just talked about right now. And you're going to have a whole system for handling emergency new patient intakes, just like there's an intake system for existing patients, just like there's an intake system for regular new patient inquiries. Okay, so you need to have all this down, and I'll say it many, many times before. It has to go with your staff, it has to go with your training. All right, this stuff doesn't just happen all on the fly. You can't verbally just tell people this is how I want it done. That's why you got to practice and take time on it. All right, so I hope that's useful. And enjoy listening to this video, watching this video. Please share this video if you can. We appreciate it, and it's been going great, and glad everybody's enjoying them so much. And I'll be back before you know it with episode 26. Thanks.